Hello, everybody. We will start our webinar discussion, and I hope everybody who have joined will participate in our discussion after our panel have been doing their presentation, and we can have and share very interesting exchange of thoughts, ideas, and have a good discussion. We have wonderful people talking here today. So how we set up our event is that first we have presentations, during what feel free to add your comments or questions in the chat. And after everybody have spoken, then we are taking and answering questions. My name is Pilla, and I'm head of Women Support and Information Center. I have been working in this topic of violence against elder women for 4 or 5 years now, and that was one reason why, or definitely why, we wanted also to present what we have and to get insight and information from our other panelists, ones who are working all over the world on the same topic. And now I will start sharing screen and have our own event going. First speaker is Beth Morrissey. She is a gerontological social work researcher and New York attorney, concentrating on aging and health policy, public health law, and palliative and end-of-life care. Dr. Morrissey holds appointments of Fellow Fordham University's Global Healthcare Innovation Management Center and adjunct professor Fordham University Gabelli School of Business and Graduate School of Social Service and Yeshiva Wurzweiler School of Social Work. She is also a president of the Collaborative for Palliative Care, under whose joint aegis she directs the Aging, Public Health and Palliative Care Certificate Program. Beth, please, floor is yours.
Thank you so much. Good morning, and thank you for the gracious introduction. I am pleased to have the opportunity to represent the International Network for the Prevention of Elder Abuse at today's event, How We Failed to Empower Older Women During the Lockdown. Next. Turning to my subject matter this morning, I adopt a syndemic frame in examining more specifically the problem of pandemic threats to older women, government's policy failures. Next. As a public health law attorney and policy theoretician and practitioner, I introduce a macro perspective to this morning's dialogue. Next. The framing of the global pandemic crisis for older women rests upon an understanding of the pre-existing structural vulnerability of older women and the structural violence of policies that have historically marginalized and excluded older women from full participation in society, enjoyment of the society's resources, and human flourishing. Drawing upon syndemic theory developed during the HIV crisis, anthropologist Clarence Gravely has described the COVID-19 pandemic as a, quote, a syndemic in the making, unquote, involving systemic racism, chronic health inequities, and the coronavirus. The syndemic integrative conceptual framework helps us make sense of biosocial patterns of disease interaction and disease concentration among clustered epidemics, and their underlying social, political, and economic driving forces, including structural racism. In the current pandemic, The novel coronavirus has interacted with chronic illness and comorbidities at the population level, especially in older adult populations. These patterns of interaction and concentration are socially produced, yet are also shaping and exacerbating pre-existing social inequities, including structural racism. Next. Within this endemic conceptual framework, I make explicit a central concern of our dialogues today. That is the marginalized but historical problem of structural ageism and age discrimination. These pre-existing inequities shaped by social, economic, and political forces have exacerbated the suffering of older persons, older women during the pandemic. With the benefit of at least partial hindsight, the unprecedented experience of the last year living through COVID and witnessing its devastating impacts upon older adults and older women more specifically, yields new knowledge about the magnitude of the threat the pandemic poses to older persons as members of families, communities, and the public. But the experience also gives us access to deeper insights about the nature of the global threats to the health of invisible populations of older women. And in these population contexts, threats to public health and public mental health, the public good, and the values of equality, adequacy, equity, justice, and decency that constitute the underpinnings of deliberative democracy. Next. A public health lens helps to shed light on the social and economic determinants of health at the intersectionality of age, gender, race, ethnicity, disability, neighborhood, income inequality, and poverty that have compounded risk for populations of older women across the globe. The August 2020 American Psychological Association Resolution on Ageism speaks to the problem of gendered ageism, or the combination of ageism and sexism, resulting in double jeopardy for older women. We know that older women are discriminated against both because they are women and because of their age. We see this same dynamic with racial and ethnic minority older women who face triple jeopardy on account of the additive effects of age, race, and gender, resulting in poorer health for older women of color compared to white older women. Older LGBTI women and older migrant women also face heightened risks of discrimination and concomitant challenges. During the pandemic, these double, triple, and compounding jeopardies with multiplicative effects for older women have been exacerbated in nearly every domain of life, such as in housing, food and income insecurity, rates of serious illness and deaths, especially in nursing homes, and limited access to health and mental health services. Profound isolation, losses and trauma, and heightened risks of domestic violence and elder abuse have contributed significantly to the persistent suffering of older women during the pandemic and the adverse outcomes that have disproportionately impacted vulnerable older women and older women of color. Next. Although available data are incomplete, there is robust evidence of the policy failures of government during the COVID pandemic, both in the United States and globally, imposing a global suffering burden upon older women. These policy failures at all levels of government have disproportionately affected disadvantaged older women and older women of color, many of whom are frontline workers with low wages, are carrying the burdens of family caregiving, are experiencing housing, food, and income insecurity, are living longer and in need of long-term care and support, are also experiencing isolation, and for those older women in long-term care settings, nearly complete isolation, and as a result have been more vulnerable to violence, abuse, and neglect during the pandemic. Policy failures at all levels of government include underinvestment in public health infrastructures, the glaring absence of comprehensive long-term care policy, and underfunding of long-term care services and supports, low wages for older women who are struggling to earn a meager subsistence, inadequate education and training and PPE for the public health, healthcare, and direct care workforces, many of whom are older women. Underfunding of programs to prevent elder abuse and violence against older women, and inadequate social welfare systems. We cannot emphasize enough the risks to older women in nursing facilities and other congregate settings that have been magnified on account of almost complete isolation and exclusion of ombudsmen, and resulting heightened violence, abuse, and neglect, as well as inadequate public health protections. On a global scale, the failure of nation states, including the United States, to implement public health emergency preparedness, to invest in public health infrastructures, to provide preparedness, education, and training to workforces is glaring. I draw your attention in particular to the government failures to develop and implement crisis standards of care, resource allocation guidelines, and effective palliative care policy and public health strategies for palliative care, and ethical minimum of care in public health emergencies that have left many older women in conditions of unrelieved suffering. It's almost a decade ago that the U.S. Institute of Medicine issued its crisis standards of care that provided clear guidelines for developing palliative care capabilities in public health emergencies, including guidelines for triage. The failure of governments to adopt such crisis standards imperiled the lives of many older adults. In some cases, triage guidelines that were adopted explicitly discriminated against older adults in the allocation of scarce resources, such as ventilators. These documented and egregious violations of older persons' human rights, including rights to health and mental health, palliative care, housing and food security, and non-discriminatory access to health systems, call for major public health, legal, and ethical reforms, including investment in public health infrastructures and systems that support older women in realizing their rights to health and mental health and palliative care. Public health protections for all older women, no matter what setting. Non-discriminatory allocation of scarce resources to older women, including older women of color, female older migrants, and other vulnerable populations of older women. Just distribution of society's resources, inclusive of social protections for all older women. Recognition and honoring of human rights of all older women, supporting their progressive realization of such rights. Equitable access to older adult care provision that includes primary, integrated, palliative medical, social, and spiritual care for older women with chronic conditions and disabilities. Redesigning systems of older adult care, including the long-term care systems, and working toward transitioning older women living with disability and compromise to the community. And finally, but importantly, expanding public health and direct care workforce education and training. It is the obligation of the professions, including health, social work, psychology, law, and all the professions, to advocate for inclusive and effective government policies. Next. But even these reforms do not go far enough in addressing the injustice experienced by older women. Justice calls for ensuring that older women have a parity of voice and participation in deliberative democracy through making opportunities available to be fully and meaningfully engaged in society and community and civic life and learning, and to participate in the labor force and receive fair wages. As advocates for older women, our critically important mission for the present and future is to march forward in a spirit of resilience, to safeguard and actualize the vital democratic values of liberty, equality, equity, adequacy, justice, and decency for all older women. Thank you.
Thank you, Mary Beth. It's very interesting and very important. Our next speaker is Anu Laas, coming from Estonia. She is a member of the network of legal experts on gender and DG justice since 2011. She is a member of WAVE Network Advisory Board. She's been a contractor for many international organizations and UN agencies, involved in several projects related to EU social policy, and contributes extensively to national and comparative international research on gender inequalities and applied gender research. Anu is a founder of the Unit of Gender Studies at the University of Tartu, freelance sociologist and legal expert in gender since 2011. Anu, floor is yours.
Thank you, Pille. I'm delighted to be with you today. Greetings from Estonia. Our women have joined international women's organizations already 100 years ago, so I'm really proud of. And I'm talking about specialists working together to help older women and results from MARVOW projects. So I go from now general picture really to field work. To give some ideas how we worked and what we did and what we found and where we achieved, what we had achieved. So I'm from Women's Support and Information Center, which was one of the first to be put into their pool of human trafficking in the Baltic states, already working already 20 years. It's an active center providing services for near 400 women a year. It's a full range of whole range of services for survivors and also providing shelter service. And we participate in several European projects regarding elder abuse already almost 5 years. And we worked with, we studied elderly abuse, we introduced it, we made guidelines, we prepared training manuals and trained specialists and volunteers. And it's very important for you all. It's a web course, MOOC, available in 6 languages now, in English, in Estonian, German, Finnish, Greek and Russian language. Next one. You see here 2 wheels, and we can ask, is here, can you see here some issue? It is Estonian women 2 years ago by age groups, and you can, in inner circle, you can see that women who reached out to women's support services are mostly women in fertile age, and the older women didn't reach there. Next one. Violence against the older person is most hidden problems in society and underreported, and it was not studied in Estonia. And we found partners in Europe, and there is the same story. And it's not reported by victims for several reasons, because perpetrators can be their closed ones, relatives, spouses, ex-partners or partners, even children and grandchildren, and also caretakers. And women are exposed to several forms of violence. There is lack of data, and it's a serious issue, because if there is no data, it's policies can't respond to our social problems. And there is also lack of knowledge. Next one. We can rely to Istanbul Convention requirements. Estonia ratified it 3 years ago, and it's also ratified in our project partner countries, in Greece and in Austria, and their national criminal codes are amended accordingly. But unfortunately, Istanbul Convention is used only in few court cases, and it's really a very bad case. And we can rely also to Victims Directive in Europe, which establishes minimum standards on rights, support and protection of victims of crime. Next one, please. And now more about our project MARVOW, which is multi-agency responses to violence against older women. And we made analysis. We studied what's the situation in our partner countries. We carried out mutual trainings in Austria, Estonia, Greece. We held discussions about existing or not existing multi-agency models, and which model can contribute and which can fit to some society or not, to make some amendments to existing ones. And we carry now out system-wide meetings to discuss cases and to identify the challenges and gaps in the system which should be confronted. Next one. And as you see in some countries, in Estonia and in Austria, it is used multi-agency risk assessment conferencing. And in Estonia, it's already a couple of years on national level, but it's focused only on high-risk cases. And we learn now to good practices from cooperated
community response, sorry.
Coordinated community response, which is wider and where also systems responses and practices are focused, and also service providers and community members are targeted. So it's very important to address and to cooperate with local authorities, shelters, local retired people's organizations, and with service providers. Next one. So we also look for inventories for risk assessment to identify elder abuse, because MARACs use mostly one inventory, DASH inventory questionnaire, which doesn't correspond to elder abuse needs to identify it. And next one. And then we studied who are specialists, who are first contact points for elder people. And we found that there could be local government social worker visiting some home if there is some sign or some call, or it's some attention paid, or there was some report to police. Police mostly refers to women's specialist service counselor, and then it's already easier to go with case on. But it's the crucial issue is how to find and how to contact and how to notify a person who experiences abuse in their home. And there was also a question who and how and whom and when to report. And if cases, some signs of violence are recognized. Next one. There we studied through our project and found that there are barriers for specialists. There is lack of knowledge, skills, and specific training regarding aging, elder care, support, also health issues of during life course, stages of intervention. There are tensions and ambivalent feelings by victims, by bystanders, by specialists. There is also task perception and attitude, which can contain both constraining and facilitating factors. There is absence of protocols and guidelines in our countries. There are rigid procedures and messaging is poor, so survivors' friendly language should be used. And this should be learned to reach and to make your understandable what support services are available and what's the way to escape from violence. And still we worked a lot with health professionals, but still there is a problem with that. Health professionals have difficulties to ask their patients about potential abuse and violence, even if they suspect it. And this is really sad story. And there is quite serious problems with data protection. Next one. And there are communication gaps that there is already more than 35 years. There was developed a staircase model to understand social work interventions stages where victim is reluctant or victim already recognizes violence, or there is already rebuilding a survivor and escaping from violence. And also information is not shared between agencies. There are several reasons, but we try to overcome it. And if you are not trained, you are unable to respond to scared older victim who does not cooperate. There is lack of knowledge, and also there is lack of supportive measures if you want to help. But we have already on the way to develop these measures. Next one. And then we try to overcome these obstacles with raising awareness and prevention of elder abuse, which requires actually an involvement of everyone. We should understand digital divide. Not everybody has internet access, and not all information should be provided only through internet. This we saw already now in this pandemic period, that elder people don't get messages from their doctors and also from government. So it's needed to change it. There is urban and rural divide, that in people in sparsely populated areas do not have same access and information what people in towns might be. There is notifying the person in need, taking it's needed a time, and fully trust the survivor's resources and to understand what the survivor is capable and on which stage survivor is. Is there already willingness to change? And this is very difficult process to take this change to every person, even for much younger people. Interventions should relate to social health and legal fields. And of course, guidelines, protocols, procedures were asked by professionals that we should elaborate these. And training is needed to address the tensions and gaps and overcome gaps. And it's very important intergenerational solidarity and women's empowerment. And next one. Let me end with some portraits of mothers by their sons, made in 19th century and in 20th century. It's serious, humble, a bit gray women. But next one. I also had, I found a photographer, Sirli Raidma, who worked hard with her mother to convince her mother to be a model and to be to be sure that she is ready to be a model. And that it took from this photographer for a while. It took really a time. So to encourage somebody to make change in their life, it can take years, maybe decades, but we should be ready for that. And we all work for being surrounded by self-confident, beautiful, and happy women. Thank you. And the next one, there is some additional resources available. You can look to MOOC course and take contact with us. Thank you.
Thank you very much, Anu. That is very interesting, especially to see how women can be portrayed and how actually this can change yourself when you are changing your appearance. Our next speaker is Elsie Yan. She is an associate professor at the Department of Applied Social Sciences, the Hong Kong Polytechnic University. Her research interests include family violence with a focus on elder abuse, elder sexuality, and dementia care. And Elsie, floor is yours.
Thank you. Thank you, Pilar, for organizing this, and thank you for having me. So today I am going to talk about marginalization of older women in Hong Kong during the pandemic, and I feel some of the materials that I cover in this presentation actually echoes with those our previous two speakers talked about. And again, thank you very much to Beth and Annie for the very good presentations. Next, please. Right, so I don't need to mention this again. COVID-19, the first case was identified in late 2019, and I updated the figure just yesterday. As of to date, we have 121 million confirmed cases and more than 2 million deaths. And apparently COVID-19, the pandemic, affect older population to a much greater extent than the younger one. And in their attempt to control the spread of the virus, authorities have used various strategies, such as suspension of public services, closure of some premises such as restaurant or hotel that were considered high risk, quarantine people who were in contact of the virus, and complete some even have complete lockdown of the cities. And this is very much the same in Hong Kong with various policy that affect the lives of people. And those policies and those exercises, they have important implications for lives and well-beings of older women. Next, please. Well, the way I see it, I think the pandemic exacerbated existing vulnerabilities of older women. So there are vulnerability in place already, and the pandemic actually make it worse. And at the same time, it actually created new avenues for injustice and unfair treatment of older women in Hong Kong. The good thing about it is is that it actually brought our attention to some of the discrimination and disadvantaged position of older women in the community that has been there all along. And that gave us an opportunity to address them. Next, please. And if we look at the international figures, there is no doubt that the pandemic affects older persons to a much greater extent as compared to the younger population. So if we look at the fatality rates by age, older people who were confirmed case of COVID-19, they were actually at much greater risk of dying from the disease. And as mentioned earlier, there are various policies in Hong Kong that affect the lives of older women, and I will try to summarize some of those in the following. Next, please. Well, first off, there is a cessation of public services. Normally we have some sort of social services supporting caregivers and senior citizens in the community. But because of the COVID-19, many of those services were halted, put to a stop. And the pictures I show here were a press conference held by an advocacy group urging the government to resume public services. Next, please. And as mentioned earlier, most services such as home help, Meal on Wheels, daycare and respite services, those were all stopped during the pandemic. And so the care responsibility fell back on the family caregiver. And as you could imagine, because of the higher longevity, many of the caregivers in Hong Kong were women. And because of the tradition that women tend to marry men that were like older than them, so many of the family caregivers in Hong Kong were women. And so that add extra stress to them. And in this case where we have a woman being the care recipient, it doesn't make things any better, because like some of our studies show that caregiver stress is actually a major risk factor for elder abuse in Hong Kong. So what we see is the pandemic increased caregiver stress, and that is bad. And then at the same time, caregiver stress may eventually lead to elder abuse. Next, please. Okay, and another interesting thing that we observed in Hong Kong is at some point of the pandemic, we have people have a shortage of surgical masks. So like people were convinced that they need to wear surgical masks pretty early on in Hong Kong. And then we have older women being sent off to queue to purchase this surgical mask. So picture, I downloaded this picture from local newspapers. We have this this older lady arriving at a store 3 a.m. to queue so that she could buy a surgical mask for her family. And then right next to her, we have another lady being told the store ran out of surgical masks, so she won't get anything despite having been waiting in the queue for a very long time. Next, please. Right, and if you look at the two pictures on the slides here, if you look at the people in a queue, most of them were old ladies. And so first off, older persons, they may not have the necessary knowledge or resource to shop for those surgical masks online. And some of them may feel they have the obligation to go queue for those surgical masks because they're younger family members. They may need to work, they may need to go to school, or online or in person. And the problem is many of those queues, those places, they are packed with people, and it actually increases the risk of one being in contact of the virus. So it doesn't really make sense for us to send the more vulnerable, more risky people of our population to stand in the queues. Next, please. And at the same time, we have homeless older persons in Hong Kong. This is a picture of a typical public park in Hong Kong, which easily houses 70 to 80 homeless people. And next, please. Right. And in March 2020, the Hong Kong government actually started a new policy which banned gatherings of 4% or more. And at the same time, they closed down restaurants and fast food chains, forcing what we call the MAC refugees back onto the street. MAC refugees is a term people in Hong Kong use referring to homeless people who would take shelter in restaurants that operate 24 hours a day, with McDonald's being one of those examples. And so people who could usually sit in a restaurant when in the middle of the night for a little bit and rest a little bit, they were being forced back onto the street. And at the same time, there were closure of facilities such as shower in parks and sports facilities that result in hygiene problems. So normally, homeless people in Hong Kong would go to use the facilities to clean themselves, to have showers, etc. But that is not possible during the pandemic anymore. And then there is also other social distancing measure. As mentioned earlier, we actually banned a gathering of 4 persons or more. So the routine social services, charity, volunteering services, they were all stopped during the pandemic. Next, please. And then there is hospital and aged care facilities. During the pandemic, even till now, we have actually banned all visitation to hospitals and to residential care facilities. So older persons, older residents in these facilities, they lost all their social support and social networks because they can't be visited by their families anymore. And obviously, this increased sense of loneliness and depressive feelings, and it could be particularly difficult for persons with dementia who may get confused and may not be able to understand how the current situation is like. Next, please. So in view of this, some staff at long-term care facilities, they actually help their residents to communicate with their family using online measures. But as you could imagine, the staffs are we are very short-staffed in Hong Kong, obviously, and then staffs are busy taking care of the pandemic, like trying to keep the facility clean, etc. So obviously, not many residential care facilities have that resources to help their residents communicate with the families using online measures. Next, please. And then we have many older workers working in low-wage, low-skill industry, and they are being paid on an hourly or daily basis. There is no income protection whatsoever for them. And because of the economic downturn, many of them actually get laid off. And most likely, it would be unlikely for them to find new jobs given the economic downturn. And as you could imagine, many of them were women. Next, please. And for people who were quote unquote lucky enough to keep their job, they face other problems. What we observe is that lots of older workers in Hong Kong, they may not have enough protective equipment. So this is an average average life of a sanitation worker. And obviously their job exposed them to risk of contacting the virus. But at the same time, I told you earlier that it's very difficult. Well, at some point it was very difficult for people to get hold of surgical masks. So some sanitation worker reportedly used secondhand surgical masks. So like they come across masks that has been used by other people and then they use it. That was just very sad. And to look at like the scale, the craziness of people going after surgical masks, I put up the picture on the right. So this is a box of 30 to 50 pieces of surgical mask, and it was priced at US $230 per box. So as you could imagine, if you are working as a sanitation worker, you probably don't get paid a lot. And it is simply impossible for you to get hold of some surgical masks to protect yourself. Next, please. So I mentioned earlier, this worker working at high risk places, they may not have enough protective equipment, surgical masks or gloves. And some small scale survey have been conducted in Hong Kong. In a survey of 149 sanitation workers, 30% of them were not given any surgical mask, and 40% were only given one surgical mask per day. So like you could, I don't know, there is respiration and then you could drink some water and go have a meal and then you have to put that mask back on your face, which is obviously not desirable. And 85% of them mentioned that they had not received any training in relation to COVID-19. So that is pretty weird if you ask me. Next, please. So I summarized some of the things we observed in Hong Kong, and we feel that we should take this as an opportunity for us to rethink, re-examine, and reflect on mistreatment beyond the domestic setting. So what we did was we actually did a telephone survey to look at elder abuse and discrimination during the pandemic in Hong Kong, and I will share more of the results tomorrow at the Human Rights Perspective on Violence Against Older Women and Widows. And then we are also starting new project to develop culturally sensitive screening instrument, manuals, protocols, etc. The important thing is we need to continue the advocacy effort to give the voice back to the older women in Hong Kong. So that's the end of my presentation. Thank you very much.
Thank you, Elsie. It is very interesting what you told about, and wow, the price of the masks. We know everywhere, I think, the price went up, but so crazy. It is a lot. And now I stop sharing my screen, and we have our next presenter, who is Andrea Ferenzi. Andrea, you can start sharing screen while I'm telling about you. Andrea has 30 years of experience in the fields of women's empowerment and career development. She is an entrepreneur and founder president of the Association for Women's Career Development in Hungary. On behalf of the AWCDH, she has organized over 40 international conferences and founded several awards, including the Best Workplace for Women and the Women's Career Lifetime Achievement Award. She started the Women's Career for a Lifetime project in 2009 to raise awareness of the need to support participation of women over 50 and 60 in the labor market. And now, Andrea, the floor is yours. And if you have any questions, just let me know.
At Impel, we invite you to talk at this event titled How We Failed to Empower Older Women During the Lockdown. I would like to thank also the CSW65 organizers who made it possible to organize this event in virtual form, and those who are interested in this event and in my presentation. I would like to speak about the positive impact of the pandemic. In this forum, it is impossible not to talk about a pandemic, which presents the whole world with a terrible challenge. However, it also offers new opportunities. Unprecedented publicity and opportunity for sustainability and development in history of CSWs. The entire feminist world can meet here in the virtual space, where previously only the privileged could travel to New York. 2. All the organizers and participants can experience the new digital connectivity, and in the process, we improve our English. 3. The key to successful teamwork is intergeneral collaboration. This is my opinion. Another positive return is in this area of intergenerational cooperation, which has been very important in preparing this event. The Association for Women's Career Development in Hungary, founded in 2003, aims to promote women's employment by balancing the needs of private and family life. To this end, it is essential that we foster a dialogue between the legislature, the government, the corporate and non-profit spheres, and higher education in cooperation with international experts and NGOs, both in Hungary, EU, and UN level. In pursuit of our objectives, we look to adopt all positive foreign best practices within a Hungarian framework, while at the same time, we hope to present exemplary Hungarian practices abroad by utilizing our network within the European Union and the United Nations. We received the opportunity to cooperate in the work of UN ECOSOC as the first Hungarian NGO in special consultative status with UN ECOSOC. It was awarded in 2009. This recognition adds strength to our work in the field of European relations and global issues like women's equality, women's rights, sustainability, and democratic change. Thanks to our Women's Career for a Lifetime project and in recognition of our work in this area, we have been invited to work together at the United Nations with INPEA and Older Women's Network Europe, experts for older women's advocacy and empowerment. What means this issue, demographic aging in Hungary? Demographic aging is a major problem all over the world, and in Hungary, the situation is also serious. The proportion of older people is growing, and many are in full time. However, since the life expectancy of women outstrips that of men, it is of paramount importance that we draw the awareness of women to the need to continue living active and healthy lives. Life expectancy of women outstrips that of men by 6 to 7 years. What's the impact of the pandemic across the population in this country? Physical impact is tragic, measurable, but the spiritual impact will be felt in all ages. Fear of infection, fear of confinement, loss of the usual comfortable life, financial problems. How the older generation reacts? They are broadly more accepting of the situation, especially elderly over the age of 65 and 70. Why? They still have living memories of more serious tragedies like World War II, the Holocaust, deportations, the Gulag, etc. They are more disciplined and rule-following, as they already live in more modest conditions and have to manage within the limits of their pensions. Financial insecurity is less a challenge for them. Younger generations are much more impatient and more inclined to break the rules. I would like to talk about some measures and solutions that affect older people here. Hungary is a small country with many old people, largely uniformly spread. Transparency is ensured. The media publish any negative news, so we would know about it if there is a problem. Families still are in close contact here, help each other. Older people, especially women, give a significant contributions to unpaid work. For example, they care for the grandchildren and older relatives. In such families, the older people can also enjoy respect and care in older age when they become dependent. The social security provided by the government is still comparatively strong, and this is a traditional expectation of the older generation who had to benefit of the caring state in the old system. Digital education programs for old people have been available before the pandemic already, so many of them were prepared using digital aids to communicate with friends and family. They also use them in everyday banking and administrative services. I would like to report about some age-friendly measures for the elderly by the government. The government announced a pension increase last year. They have introduced the Women 40 pension scheme several years ago. This old age pension is available for women without any specific age criteria, based on 40 years of eligibility period, which is to recognize women's dual performance throughout the lifetime at the workplace and within the family community. Time spent with children is also included. People who continue to work after pension age pay a low tax, which is beneficial for both employer and employee. Older people can take part in lifelong learning. Digital education is available for seniors. During the pandemic, dedicated shopping times were made for the older people, what was not so popular for the young ones. The government's communication was seen as patronizing. The two above measures, despite good intention, created a generational divide and some kind of ageist reaction. A publication about practical advice for households during epidemic situation entitled Nutrition, Exercise and Soul. It can be found on internet and available for everybody. Some good examples. My general feeling is that there has been an increase in community spirit and people have been more helpful to each other. Thank you for the opportunity that I can share with you some good examples, some of which may be of lasting benefit with you. I would like to share with you the experiences of our two strategic partners. First of all, I would like to show you some examples of the Hungarian Red Cross. They have a membership over 120,000 people. Their activities also include helping disadvantaged families, children, single parents, visiting the elderly, providing home care, village coordinator service, health education, etc. Mrs. Fodorny Julia Doctor, Vice President of the Hungarian Red Cross. She is also a member of our organization, and she reported me the other day about her experience during the pandemic. Seniors are especially older women participate in large number of over 20% in social and charitable organizations, and they can work very well together with the younger generation. The number of volunteers increased during the pandemic. Unprecedented helpfulness is experienced. Seniors in the management and also volunteers continue to work, help with organization, administration, logistics from home office, and often in person, keeping the rules during the pandemic. So many offer their help. I would like to mention Dr. Agnes Christian, who set up a free mental health charity helpline. NOE, this is the abbreviation of the Hungarian National Association of Large Families. They have a membership of 12,000 families. They have been serving the interests of large families since 1987. There are some of their good examples. They have also experienced unprecedented helpfulness and volunteering activities in helping families with children who often had to work in home office and to teach their children during the lockdown. Inga Jó, vice chair of NOE, said, "Within a volunteer program, a senior engineer taught my son, who had difficulty in Laas. He lives far from us in Kisköros, where we will visit him after the pandemic passes." Inga has also reported about the Taste of Love initiatives. You find this project on the internet. Oh, I would like to share you with personal experiences of my friend from a village. Cooperation increased at the level of almost every community, but of course it depends on the place and the traditions there. We also learned of good urban examples when a community of housing estates moved to help each other, but most of the good examples came from smaller settlements where people know each other and help each other with shopping, pick up prescriptions from the pharmacy, or just everyday socializing. A friend of mine who recently moved from Budapest to a village 40 kilometers from Budapest said, "In a village, people are never alone. There is no privacy." It used to be rather a burden because people watch each other and know everything about each other. But now it is a good thing that people take care of each other and they do not leave anybody alone. It is good that we have space. Everything happens now outdoor. There are gardens, and the older people often produce fruits and vegetables on their one small land. They also may have some animals for their own supply. As a result of the pandemic, urban families began to move to villages where they are closer to nature, where they can live in a relatively cheaper, more human life. Good to see more children in the village, my friend said. Of course, this means that the newcomers have to adapt to local customs. They have to fit in and get accepted by the community. It takes time. I would like to share with you information about our activities for older women, how we try to include them in lifelong learning and networking. We want to empower older women by lifelong learning and networking, but we can help only those who are interested. There are those who always find an excuse not to do something for their own development or just don't motivate it. Then they lament that their grandchildren and young people are not looking for their company. I think we have to learn and develop in order to keep up with the young people. And we have to try to ensure that they find us interesting to talk to. We have started our Women's Career for a Lifetime project in 2009. Why? Compared to their number and their potential, older women's participation in economic and social decision-making is not so significant. Economic empowerment of older women by lifelong learning and networking is necessary. We consider in our work that it is most important to ensure women's education and economic empowerment across the different age groups. Our experience is that if we achieve results in these areas, we can mitigate the risk of women being dependent punished, discriminated against, vulnerable, or possibly victims in other areas. Our aim in our Women's Career for a Lifetime project to give older women, the baby boomer generation, and tomorrow's older women the opportunity to stay in the workplace and share their experience, to participate in lifelong learning, to keep playing an active role in society, to participate in volunteering, to prepare consciously for a longer, healthier, and more meaningful life. What can we do for them? We can learn from best practices, exchange experiences. We can activate, motivate women. We must honor and involve women as long as possible. We have to do the networking, cooperation of generations, and we have to maintain good relations with the media. Our mission, through our work in the domestic as well as in international arena, we have gained assurance that we must do everything in our power to enhance the lives of women above 50, 60, 70, and so on, not only with respect to employment, but other fields as well, such as lifelong learning, knowledge transfer, health, life in rural environments, art, culture, business and social services. The role of the media is promoting women's lives, IT, victimization, and poverty. In order to achieve these goals, we are working in close cooperation with the International Network for the Prevention of Elder Abuse, IDEA, Older Women's Network Europe, and Age Platform Europe. Some figures about our accomplishments. We have organized more than 20 events in Hungary and abroad, where we would welcome more than 3,000 participants from Hungary and from other countries. We have a database of Hungarian and international experts, trainers, and speakers. We have introduced role models and we have given awards. We established the Women's Career Lifetime Achievement Awards and the Best Workplace for Women Award. Some acknowledgements, we have been invited to be a member of the national level steering board of the National Smart Specialization. We are invited member of the thematic working group of women's rights and on the thematic working group of older people's rights within the framework of the Human Rights Working Group, founded by the Hungarian government with the main purpose of monitoring the implementations of human rights in Hungary. From this year, we are participating in a coast action entitled International Interdisciplinary Network for Smart, Healthy, Age-Friendly IT Environments. This is Chapter. I would like to show you some photos, some memorable photos from our event. Thank you for your attention.
Thank you very much, Andrea. I'm sorry I tried to get my microphone closer to the TV that gave a voice. Wow, all over the world, a lot of information is. Now we have some, I know that there have been quite lively chat and some of questions maybe. We have few minutes still to the end. Thank you, everybody. Mary Beth, I would ask from you first. Like you were mentioning several different public policies or policies what should be or could be taken to make people's lives better. And if you think like when you had the power, what would be the first thing of these you would do and implement?
Well, thank you, Pillay, for that question. And I want to commend my co-panelists on their excellent presentations today. I think what I focused on and try to share with everyone with us today is that not only in the United States, but across the globe, we have witnessed major failures in our public health systems and infrastructures. And certainly here in the United States, that has been shocking to so many of us, because I think the United States was viewed as having very strong public health infrastructures and systems and being a model for the rest of the world. But that's not what we saw during the pandemic. I think you will know about the failures at the federal level, but in New York State, we've also had significant failures. And I mentioned the failure of the state, specifically in New York, to enact crisis standards of care, which are standards that come into play when normal healthcare operations are disrupted. Also, the failure to enact triage guidelines, leaving practitioners on the ground to make very, very difficult decisions. And so I think we really need to call for investment in these public health systems and infrastructures. And I also want to take a moment to highlight the central importance of palliative care. And this has not gotten enough attention during the pandemic. And what I'm speaking to in this context is really building palliative care as a primary healthcare delivery system, and providing generalist level workforce education and training for all the professions. I want to commend Andrea in recognizing the importance of participation in civic life. I think we also have to connect the dots here. We have to not only train the healthcare workforce, but we also need to reach out into the community and educate community members about how to employ a palliative approach, a palliative attitude in working with others, particularly older persons and older women, to help mitigate suffering in these terrible times, and also to respond to the experience of trauma and provide social and spiritual support.
Thank you, Mary Beth. One question was in chat for Anu, and first I would say that Anu was in her presentation mentioning Istanbul Convention. This is convention that is in action or possible to use and implement only in the Europe, in the area of Council of Europe. So unfortunately, not all countries of the world can rely on such a measure, which is binding. It is more binding than usually UN declarations and measurements are. But question was that are healthcare specialists are required to report abuse when they see one, like when person is going to emergency room?
Yeah, thank you for your question. Yes, there is a really obligation to report, but in cases when there is really a sign of violence very clear, and then our health professionals really refer to police or to social worker. But if there is only suspicion and they are not so sure, they are so busy, there is a lot of paperwork, and then they skip this, unfortunately. And this is what we saw in our network. We discussed it a lot, police and social workers and law enforcement people, they expect to act by health professionals much more convincingly and to report really if there is suspect of abuse, to work with this case on and to pay attention. Thank you.
Yes, yeah, thank you, Andrea McCormick comments also that most vulnerable do not get the attention, and we can totally resonate here in Estonia. One question to Elsie from, I'm just listing all my questions, I have the the chance to do it. When you told about how older people feel obliged to go out and do this, basically put themselves to larger or bigger risk than younger ones, if we compare like how fatal is COVID for older people than for younger. Is it something that they, how do I, for me, I was thinking that our elderly are basically forced to stay home. Is it something that they feel themselves obliged, or that they also feel that families expect them to take some actions for the family?
I think I try not to say it is a Chinese cultural thing. Like, it is my general perception that grannies, grandmoms, they tend to like sacrifice themselves for their families. And I think it is a global thing.
Yeah.
So yeah. I think it is like the sense that they need to sacrifice themselves for the benefits of the entire family.
Yeah, for me it was interesting because we, like, as we know, I think it, I don't remember which countries they were, but they totally prohibited, like basically restricted going out for people 65 years and older. So seeing that was a little bit strange. Yes, and my last question to last and the best lady. Andrea, if you named many good initiatives. If you think that we are here like as global partners, what would be one or easiest or the best thing what you suggest that everybody should start trying implementing or going for this initiative, what you have presented us?
You know, well, my experiences about aging as an aging person. At the same time, I have learned a lot. So it's I try to present my own experiences, because last year, for example, I took part in 2 trainings, in Hungarian aging training and in one organized by the WHO. It's a leadership training at the beginning of the decade of healthy aging. And I would like to encourage all the women to take part in lifelong learning. And I would like to encourage young people or the younger generation to listen to the older people as long as they can. You know, because they must love, or they should love, the older persons. Maybe sometimes they seem boring, but at the same time, they have a life experience. And life experience, in my opinion, that's the biggest knowledge. And nothing can replace that. So I would like to do something for the international cooperation and mutual respect and love. And the importance of the family, because it's I know that the global tendency is not that, but maybe after COVID the world will change, or some people will change. It was a tendency that people went to the big cities from the villages, and this is our experience in Hungary, that people coming to the villages. So we don't know. It will be a whole world. We have to be open to listen to each other and to be ready to accept, each other. And if there is a good thing we learn, we should influence other people in the right direction. So these are my feelings.
Thank you very much. I'm very happy that we got such great team of experts here talking.
Thank you very much. Thank you.
And yes, to one question, I don't remember who asked for it, but we are uploading, and some presenters have uploaded already their slides. So next to our event, there is chapter of files, and under files you can find everybody's presentation. We upload last ones also, and also some info materials about training materials about this internet course. I'm really yes. Go and look for information we all have provided, and I believe that it is such a sharing is really very useful. We can maybe, if somebody else from audience wants to give any comment, we have still few minutes left, or we can happily close in this place. Now the decision is yours. No pressure. I'm very grateful. Thank you very much, and I hope that we are going to meet soon and have our great discussions, and we will make world a better place. We have still a little bit of time. Thank you and enjoy your day.
Thank
Bye.
you.
Thank you very much. Thank you for the opportunity to be here. Thank you.
Thank you very much. Appreciate it all.
Yeah,
Thanks. Good night.
bye.
Thank
Elsie,
you.
Mary Beth, wonderful women. Thank you so much, Sylvia. Pat, Robin, everybody. Take care.
And Mari, maybe you stop recording.